Greetings to all of you who've joined our platform today. My name's Lesley Regan. I'm an obstetrician and gynecologist, and I'm the new or incoming chair of Wellbeing of Women, the charity that funds research into every aspect of women's health from cradle to grave. Now, I'm very excited because this is the first webinar of 2022, and I'm really pleased that this is one of a series of webinars entitled Let's Talk Periods. And why I'm pleased is that most of the women and girls that I know have 12 periods a year for nearly 40 years of their life. So these are a really, really common issue. And yet so often they are talked about behind closed doors, really still a bit of a taboo subject. So we're going to be exploring two very common conditions that particularly cause heavy and painful periods. We're going to be talking about fibroids, non-cancerous growth that develop in or around the womb, and adenomyosis, which is a condition in which the lining of the womb is found deep in the muscle of the uterus. And we know that these are common. About 1 in 3 women will develop fibroids at some point in their life, and adenomyosis can affect as many as 1 in 10 women of reproductive age. And yet these conditions are often very hard to diagnose, and many women that I see in my practice have spent many years trying to get answers to very simple questions. Why am I having heavy or painful periods? So I'm absolutely thrilled to be welcoming our two speakers, and I know that after you've heard them you will understand why I'm so thrilled. The first is going to be Dr Varsha Jain, who is a Wellbeing of Women Research Training Fellow at the Medical Research Council Centre for Reproductive Health at the University of Edinburgh. And she's looking into, as part of her research, why women suffer from heavy menstrual bleeding due to conditions such as fibroids and adenomyosis. Now, I can't take up any more time to tell you all about Varsha's extraordinary CV, but she's got a master's in space physiology and all sorts of other wonderful attributes, but I don't want to detract from the topic today. So what we've asked her to do is to talk about all the basic things about what fibroids and adenomyosis are. And then I'm going to move to our guest, Francois, who is a rather spectacular performance artist and life coach, a creative coach. She's an education consultant. She's contributed to the training educational tools such as PHSE for school children. And she has made an enormous contribution in talking about the problems that she's had. And she's going to tell us a little bit about her journey, which was a very painful and distressing journey for her at an earlier stage in her life. But firstly, over to you, Dr. Varsha Jain, so that you can lay the scene for us and get us all the building blocks so that everybody on the platform really understands what we're talking about. Thank you to everybody. Please remember to post any questions you have in the chat, because the Q&A function at the moment is disabled. And please make sure that you put your questions up there as soon as you can, so I can, at the end, choose most of the ones that are recurring, if you like, or most commonly being queried, and then we can ask our two panelists to help provide answers. Over to you, Varsha. Thank you.
Thank you. Thanks very much for this opportunity to speak. And I'm really excited to be able to talk to you all today about fibroids and adenomyosis and the research that I'm doing. I'm just going to share my screen so that you can see. I've got a few slides to help me. There we go. So we're talking about fibroids and adenomyosis. And as Professor Regan mentioned, periods are really a taboo subject. So I just want you to think about how many times you've actually said that you're talking about periods, or you've used another name or word for your periods. Quite often, I feel that most people will have hidden what they're talking about. Let's just start from the beginning. So what is the menstrual cycle? What are periods? Essentially, this is bleeding from the lining of the womb when there isn't a pregnancy. So the uterus or the womb goes through a cycle every sort of approximately 28 days, where it goes through a period of growth and regeneration, followed by ovulation, where an egg is released, after which there's a change in the cells to promote a healthy environment for a pregnancy. If a pregnancy doesn't occur, then the lining of the womb is shed. That injured lining of the womb that's left behind has to repair and grow again, and the cycle repeats. That leads to a period right at the beginning of the menstrual cycle. However, some women, unfortunately, will suffer from having 2 periods every month or really regular frequent bleeding that they have no pattern to whatsoever. Now, why is this important to talk about? And it's because heavy periods affect 1 in 3 women of reproductive age. That's a huge number of women. In 2011, a study showed that about 1.5 million women in England and Wales were affected by heavy bleeding. That figure is more than 10 years old, and I'm pretty sure that's a huge underestimation. Heavy periods are the 4th most common reason for women to be referred to gynecology clinics. So we're seeing this very often in clinic as gynecologists. And heavy periods have a huge impact on a person's health and well-being. So we know that generally women have trouble getting pregnant with it. Heavy periods leads to iron deficiency, which in turn leads to anemia, which makes people feel exhausted, lack of concentration, inability to be able to do their day-to-day activities. Heavy periods has a huge impact on mental health. So 50% of women with heavy periods said that the cause of their depression and anxiety was their periods. It leads to social isolation because women can't leave the house. And also has an impact on women's ability to work, and therefore impacts the socio-economic effect of the women themselves, but also society as a whole. And because treatment and management options just aren't good enough, 1/3 of these women have to resort to hysterectomy, which is a major operation in which the womb is removed. It impacts all of society. So everyone sort of in that person's life is impacted because of heavy periods. And whilst heavy periods might not be life-threatening, they are definitely life-altering. So what we've got to talk about what is normal and what's common. So these are words that quite often get put across, but actually what are we talking about? So let's talk about what's normal first. So when we're talking about periods, the question is, how often are your periods coming? So every 24 to 38 days are normal. Textbooks will always say 28. It doesn't have to be 28. There's some variation in that. How many days do you bleed? This can be anything up to 8 days is counted as normal. The gap between each cycle should be pretty regular, but if that's greater than 7 to 9 days, that's abnormal. So you want it to fit within 7 to 9 days. And what's the bleeding like? That's very subjective. It's got to be normal for the patient. So what's sort of outside of this? What is heavy periods and how do heavy periods fit in with this? So if periods are generally becoming more frequent, so less than 24 days between each cycle, that would be counted as something that you would term in that bracket of heavy periods. How many days of bleeding? How many days is the bleeding lasting? More than 9 days. So it's a prolonged cycle. Again, that's important. And heavy periods can really occur in a regular pattern or an irregular pattern. And the bleeding is subjectively, essentially heavy for the patient. There doesn't need to be a quantity or an amount added to this. The patient saying it's heavy, it's heavy. And then we talk about common. So I said in the last slide that this is affecting 1 in 3 women. And as you can see, that falls into the very common bracket. That means that that's at least 1 or 2, everybody on this call, maybe at least 1 or 2 people in your family has suffered from heavy periods. But I would ask is, have you talked about it, or have you ever brought this up as a topic of conversation? So what causes heavy periods? So we know that there are conditions within the womb that can cause heavy periods. So this is here on the left-hand side. And there are conditions within the body as a whole that might have an impact on the womb to cause heavy periods. And today we're going to be focusing on adenomyosis, that's the A over here, and leiomyoma, which is the fancy term for fibroids, and the fibroids are here. So we'll go into this in a bit more detail. I'll start with fibroids because I think more people know about fibroids. So what are they? They're essentially a growth in the muscle layer of the womb. The growth is made up of the same cells that the muscle layer is made up of, so smooth muscle cells, and they can be positioned anywhere in the womb, so really quite close to the lining of the womb, or really far out as well, high up top or down right by the cervix. And they can be different sizes. Women can have 1 or maybe more, and they can have a huge impact either on bleeding, but also pressure symptoms where they affect bowel habit or bladder habit. A lot of people talk about risk factors for fibroids. So if you have these risks, you're at a higher risk of developing fibroids. So the biggest one, a large study was done a couple of years ago to look at all of the risk factors. And the biggest one they found actually was high blood pressure. So women with high blood pressure were 5 times more likely to have fibroids than women without. Age played a huge impact. So in a UK study, women aged over 40 years were 4 times more likely to have fibroids compared to women less than 40 years. And actually, if the fibroids are in women who are premenopausal versus postmenopausal, 3 to 5 times more likely to be really suffering from the symptoms. Family history is really important. That has an impact of 3 times more likely to suffer from fibroids if someone in your family does. And eating processed, sugary, tinned foods, they can increase your risk by 3 times as well. Finally, ethnicity is also really important. So women from a Black ethnicity are 2 to 3 times more likely to suffer from fibroids. And then the age gap, so the gap from your last child. So if it's more than 5 years since the last child, 2 to 3 times more likely to suffer from fibroids. And I'm talking about risk factors, but I haven't actually said what causes fibroids. And that's because we just don't know. We don't know what's that starting point of why women are developing fibroids. We know that they're more common in families, but why? Why does this actually even happen? And if somebody knows that a woman in their family has fibroids, is there anything that person can do to prevent their growth from happening? We just don't know. If someone already has a fibroid, how can they do, or what can they do in order to make that fibroid shrink or go away? We just don't know. And again, lots of fibroids grow at different speeds, at different locations. Why does that happen? And why do some grow faster? And how can we slow that growth down? These are all questions we just don't know. That's just scratching the surface of what we don't know about fibroids. Where I come into this is fibroids are essentially in the muscle layer, but they're causing the lining of the womb to bleed abnormally. And we just don't know why. What's the interaction or the connection there? And that's my research that's being funded by Wellbeing of Women. So I'm going to introduce to you what we would do about it. So if a woman has fibroids or heavy periods, she would go to a gynecologist, investigations would be done, ultrasound scans, for example, taking a tissue sample from the lining of the womb. And once all of that is done, blood tests to make sure she's not anemic, once all of that is done, we'd offer you treatment options. Unfortunately, as gynecologists, we have a shopping list. We can offer you treatments. If they don't work, we end up being able to offer you surgical options. But I'll go through these one by one, and these are the options really that we have. Quite often women have fibroids, they don't know they've had them. And so for them, no treatment is absolutely fine. But there are options of medical treatments. So these could be non-hormonal treatments to help control the bleeding, or hormonal treatments, again, to help control the bleeding or regulate the cycles. They could be in tablet form, or this is a Mirena coil, which is a hormone coil that sits inside the womb and lightens periods. There is the possibility of an injection that's a hormone-based treatment. It's not a hormone itself, but it works on the hormone pathways, and it essentially creates an artificial menopause. So that just stops periods temporarily for women to get a relief from that bleeding. If these don't work, there are surgical options. There's evidence and there's research to say that ultrasound can be used to help target those fibroids and that growth. You could temporarily stop the blood supply to the uterus to make those fibroids shrink. Possibility of doing an operation in order to remove the fibroids if the person wants to retain their fertility. That could be laparoscopic as well. It doesn't need to be a big cut into the tummy, or the option of having a hysterectomy. Now, out of all these options, the hysterectomy really is the guaranteed no bleed option that we can offer. Let's look at adenomyosis. Adenomyosis is when there are cells from the lining of the womb that are found in the muscle layer. Those cells respond to the monthly changes in the hormone cycle of the menstrual cycle. They do try to bleed, but that blood has nowhere to go. And so that creates a painful period. The muscle layer and the texture of the muscle is changed, and that can cause heavy bleeding as well. And it can have an impact on a woman's ability to get pregnant. Now, I'll talk about causes just mainly because the way adenomyosis is traditionally diagnosed and the gold standard is after a hysterectomy. So where you get some of the tissue and you have a look at it underneath a microscope. But really that isn't wasn't technically being done until women in the late 40s or early 50s when their families were complete. So there's a huge gap in the knowledge as to what's actually causing adenomyosis, why it's happening, when it starts, and what's causing it to progress. There are some theories. So just like these rabbits are burrowing down, the lining of the womb potentially could be burrowing down into the muscle layer to cause it to implant abnormally in the muscle layer and sort of stay there. In that process of the lining of the womb shedding every month, is that injured layer of the lining of the womb having to repair itself. In that time of injury and repair, there could be some problems, and that could make the cells abnormally placed in the muscle layer. Or it could be the fact that stem cells, so these are cells which have the potential to grow into any sort of cells, stem cells could be involved to create abnormally placed endometrial cells, that's lining of the womb cells in the muscle layer. But we just don't know. There are loads of questions with adenomyosis, and that's really because it's been so difficult to diagnose. We still don't even have exact numbers on how many women are affected by it. But what causes it to start? What causes people to have it? We don't know. Does it even run in families? We think it does, but why? Is there a way of preventing it from occurring? Can you make it disappear once it's there? All these questions are big question marks because we just don't know. And then can we detect adenomyosis before it's already having an impact on a woman's life? It's called an enigmatic condition because really quite often we don't even know that it's there. And again, my question from my PhD, which is being funded by Wellbeing of Women, is why does a condition in the muscle layer of the womb cause the lining of the womb to bleed abnormally? And hopefully I'll have answers to that at the end of my PhD. So again, I'll bring you to this shopping list of treatments. Quite often women don't know that they have adenomyosis, so doing nothing is absolutely fine. Medical treatments are available, so exactly the same medical treatments as before. So non-hormonal treatments in order to control the pain or bleeding, hormonal treatments for the pain, the bleeding, or regulation of cycles, Mirena coil or hormone coil in order to lighten bleeding, and really the option of stopping periods just temporarily, really, if that's the relief that the patient needs. Then in terms of surgery, we're sort of limited. There are some studies that have shown that ultrasound could have an impact on areas of adenomyosis within the womb. Possibility that blocking the blood supply can temporarily reduce that adenomyosis that's there. But again, the only real treatment that we can say that gets rid of it completely is a hysterectomy. And when to seek help. So quite often I find that women will come to clinic at a younger age to seek help because they're not able to get pregnant. But I would ask you to think about other aspects of when women are being affected. So right from childhood up through their reproductive years, is it affecting education, the ability for that career progression, the ability to work or get to work, the ability to concentrate whilst at work and the career progression whilst there, or opportunities that are being missed because of the heavy periods. When at work, are these women toilet mapping? In essence, are you constantly thinking about where the toilet is? You're not wanting to be able to leave your seat because you're worried about a flooding event. Is the anemia that's being caused by heavy periods leading to a lack of concentration, exhaustion, fatigue? I have patients coming in who say on day 2 or day 3 of their cycle, they just need to sleep all day because they're so tired. Heavy periods has an impact on relationships. So are relationships being affected by periods? Is it affecting a person's sex life? Is it affecting their relationship with their children? They're having to spend so much time just worried about the bleeding and when to change pads, tampons and things. Is that person able to leave the house? So that person is being socially isolated. They're not able to leave the house for 1 week, 10 days of every month. That's having a huge impact. And if they are able to leave the house, what are they wearing? Quite often women will say, I'm not able to wear light clothes in the summer. I'm having to wear all black in the summer because I'm worried about flooding. So these are all aspects of when to seek help. But quite often what I find is women get told, just get on with it and deal with it because it's your period. And I have to say that time has come to an end. I think we need to encourage women who are suffering from this, but also each other, that actually periods aren't just to be dealt with. They should be something that you seek help for. So I just want to say thank you. If the research or the questions I posed are interesting to you, please do support Wellbeing with Women. And I know that Professor Regan is going to give some details, but I just want to say thank you to everyone who's been involved in my project.
happens once, doesn't it? I was muted. Thank you so much, Varsha. That was superb. And I particularly love all the infographics. So I always think, you know, if you can show a picture, it says 1,000 words. So thank you very much. Now, without further ado, I'm going to invite Kat Francois to tell us a little bit about her journey and the impact that painful periods and the late diagnosis of adenomyosis has had on a variety of aspects of her life. Kat, thank you so much for joining us today. We really, really appreciate you coming and sharing with us all these very personal things. So thank you. The floor is all yours, or the Zoom platform, I should say, is yours.
Thank you very much. And thank you, Dr. Varsha. It was really interesting to sit back and to watch that, actually. And it kind of reminds me how serious these conditions are and how we can spend quite a long time convincing ourselves that it's not as bad as what it really was. So that definitely hit home. So I started puberty quite early, not so much early these days. We find children are starting periods earlier and earlier, but in my time, I started at 10, I was still in primary school, and I was the first girl in my class to start. I wasn't a big child, but I was quite tall and athletic. And I just remember pain from the very first day that I had a period. I just remember that they were painful. And then when I got to teen years, they then were accompanied with vomiting. So now not only were they painful, but I was actually vomiting as well. Every time I would go to the doctor, then my mum would, oh, they're normal, they're normal, they're normal. But none of the other girls in my class, I'm one of 4 girls in my family, none of the other girls were suffering like that. So to me, it didn't seem normal. So I had to manage that through school life. You can imagine it has an impact on your learning, an impact on your education. And then the only thing they wanted to offer was the pill. Obviously, my mum wasn't too up with that idea of putting someone so young on the pill. But I remember as soon as I turned 18, I got the pill and I was quite happy to have something that would just knock the symptoms on their head. But as I learned in the future, it takes away the symptoms, but it doesn't take away the problems. So really all through my life, I suffered with problematic periods. I took the pill, went on the injection. Contraceptive injection would come off every so often just to make sure that my periods were okay, have a little break, because I didn't think it was good to stay on them for long. And all the time the doctors was like, it's all right, it's nothing to worry about, it's okay, it's just normal periods. And you know, they're doctors, so you convince yourself that they must be right. I'm unlucky, I just have bad periods. And then when I got to my 30s and decided, okay, now it's time to try for a baby. So obviously I had to come off all of the contraceptive injections. And that is basically when all hell broke loose. And I had periods that, I don't even know how to explain, but basically pushed me to the brink of sanity, where I would be vomiting for 4 and 5 days. And the vomiting would not stop until I literally went to hospital and had to get injected with anti-sickness injections. Pain so bad you'd want to smash your head against the wall. The bleeding, you know, I can remember one time bleeding on the street, and luckily I was with my partner. And if anybody had saw me, it was such a massive flush, they would have thought that I was having a miscarriage in the street. That's how bad it was. And I remember, you know, standing there and crying. And luckily I was with my partner and he walked me home. And the things that man has done, picked up vomit, picked up blood from the stairs. I mean, that stuff he was talking about, it having an impact on your relationship. It has a massive impact on your relationship. So yeah, that's my story. I mean, it was finally found out. It got to the point right up until 2020. Every month I was in the hospital, 1 night, 2 nights, 3 nights sometimes, because the bleeding and the vomiting, it got extreme. But I happened to go into A&E one night, and there was an old Irish doctor, and he was like, listen, you're in here every month. Let's try and find out what this is. He was just like, this is not normal. And they did an ultrasound, and you know, they did an internal scan, and he's like, you've got adenomyosis. Now, I'd never heard of this. I was like, Addy who? Addy what? I said, what is this thing? It just blew my mind. And I'm someone who has taught sex education for many years, and I'll specialize in, you know, the puberty age range. But I'd never heard, in all my years of teaching and all the years of education I've had around it, I've never heard of it. And I was completely shocked. But unfortunately for me, this thing had been left so long that I did have trouble getting pregnant. And there was an underlying problem. I had a low egg reserve count, but it's one of these things that if it had been found out when I was 20 or 25, that actually there was quite a lot going on with me gynecologically, maybe, you know, my fertility story would have ended differently. But it took so long to diagnose adenomyosis, so long for it to be brought up that I had these issues with fertility that unfortunately by the time they found out, there was very little choice left. I am lucky now. I was on the verge of having a hysterectomy, but they put me on decapeptyl, which was an injection that just puts my periods asleep for a while. I'm on that for the time being on a long-term basis. You're not really meant to take it long-term, but because I am a personal trainer and I work out and I strength train 3 times a week and I run, and then monitoring my periods at the moment, they're allowing me to stay on it. But if it ever comes to a point where that doesn't work, to be honest, I am at a point where the next step, unfortunately, would have to be hysterectomy. So yeah, that's kind of like my story in a nutshell, really.
Thank you, Kat. That's very, very generous of you to share all of those very painful, not just physically, but I think emotionally painful situations that you and your wonderful partner have had to deal with over the years. So as Varsha was saying at the beginning, this may not be life-threatening, but it's very, very life-altering. And we really do appreciate it. Now, there's lots of questions coming in, and I'm just going to try and ensure that I've got a good span of them. One of the questions that was asked was whether if you've had, or was a woman who was saying that she was diagnosed with both fibroids and adenomyosis and then got an ovarian cyst to boot, and saying, what's the likelihood that my daughter is going to have similar issues? So Varsha and Kat, any comments about, family traits or genetic traits that we know about?
In my family, out of the 4 girls, I was the only one, but I do have about 2 cousins, female cousins, unfortunately, who one has endometriosis and one is in her early 20s, and it sounds like she's probably got adenomyosis. So
certainly, Varsha, there are no specific genes, are there, that we know of, but there is certainly evidence that sometimes it runs in families. I often have ladies saying to me, well, my mum had this and my mum did whatever.
Absolutely. And I think the question, so there's, I think, with fibroids, I think there's a lot more recognition with fibroids. We know how to pick them up on ultrasound. The problem with adenomyosis is quite often the patients that come into clinic to be seen and they get diagnosed with adenomyosis, quite often their mothers or their grandmothers would have just been told they need a hysterectomy and would not have received a diagnosis. So quite often we get women who say, well, I think my mum had a hysterectomy quite young because she had heavy periods, but we don't know why. And so that information just isn't there for us to be able to target that research as well, which I think is why it's so important that we actually talk about conditions like adenomyosis, like Kat was saying, so that we can increase the awareness and we can increase the fact that we need to do studies into this, into understanding what is happening. So yes, we do think they do run in families, unfortunately, but at the moment, there's no way of knowing who will be affected or why that's happening.
Thank you, Varsha. Now, our panelists, or rather our audience, are very, very alert here. And one of our audience says, well, you've mentioned, Varsha, that if there's greater than 5 years, there is an increased risk of fibroids. Do women with no children have an even greater risk? So you mentioned if there was a 5-year gap between pregnancies, there was a bigger risk of fibroids. What about women who have no children?
So I think the answer here is related to the impact of the hormones that are happening on a monthly basis. So when a woman gets pregnant, there's a temporary pause in the hormones stimulating that uterus. And so what's happening when women aren't pregnant or they haven't been pregnant yet is that their uterus is being stimulated by those hormones, and fibroids and adenomyosis are conditions that are affected by those hormones. So yes, it does seem that some women would be more prone because that pregnancy gives that gap. And like Kat mentioned, putting someone into the artificial menopause, so it just gives that gap of the uterus being stimulated. So that's where that thought process is there, yeah.
And that's one of the reasons, isn't it, Kat, that the decapeptyl and other drugs like that have come into practice, because it's basically suppressing the cycle. Now, is there a link between having endometriosis and developing adenomyosis?
So the literature, the researchers are torn. there's a school of thought that adenomyosis is an extension of endometriosis. So just to explain, endometriosis is a condition where cells similar to those found in the lining of the womb are found elsewhere in the body, so outside of the womb. And that can be in the pelvis, in the abdomen, even as far as up to the lungs as well. And those cells respond to the hormone cycles and bleed. Adenomyosis is restricted to the actual uterus itself. And so some researchers think that, yes, it's an extension of the same condition. Some researchers think, no, it's two completely different conditions. So I don't know the answer to that, to be honest with you, because we don't know what causes endometriosis. We don't know what causes adenomyosis. And I think until we have those answers, we can't answer that question completely either.
Thank you very much. Now I've got a question for Kat. And one of our audience is asking about, are there any natural remedies? And I suspect that you may, if there are any out there, you might be somebody who's experimented with them. Would you like to help us with that?
Yes, I would love to answer this question. Yes, I've tried many things. If someone had told me, you know, spin on my back or spin on my head, I would have tried that as well. But one of the things I did do is I really started to take care of myself. As we all know, we live very busy lives and sometimes don't take care of ourselves as much as we should. So I really got into health. I really got into fitness. In fact, so much I trained as a personal trainer, and I really looked at my food. So I cut down on things that were heavy with hormones. So foods that were maybe pumped with artificial hormones. I looked at how much meat I was eating and tried to eat as organically as I could. But one thing that did make a difference actually to the pain was cutting back on sugar. Cutting back on sugar really helped, but just overall, just looking at how I was treating my body and if there was anything I can do. And plus, you know, when you're going through this and you are tired, and I did end up being anemic, I had to make sure I ate enough iron. I needed to make sure that I rested if I could, because as we all know, it's not just the period. If you're having painful, heavy periods, then it's the recovery. So half of the month, 2 weeks of the month, you can be down and out. So I think it's about just looking at how are you taking care of your body, and is there anything else you can do? And if you're eating a lot of processed food and you're not exercising, maybe looking at those things and seeing how you can improve your lifestyle as a whole.
Thank you. Apart from meat and other things, what would you just give our audience a feel for the sort of what you call hormone-rich foodstuffs? So
like soya. Is that, I see Dr. she's nodding her head, so I'm glad I've got that one right.
Yeah, that's a 2.5 times increased risk if there's lots of soya in the diet.
You see. So, you know, like, and I'm vegetarian, so I was drinking like a lot of soya milk. I was eating a lot of soya products, you know, all the vegetarian ready-made products. So I had to start looking at those as well. And even down to, I mean, if you want to get into deep, you can look at it even down to the chemicals that we're putting in our body, because there are some chemicals that have got artificial hormones in them and can have an impact on the body. So it's worth investigating and it's worth looking at. So even now, even though I am on this medication that it's not my periods, I still try as much as possible to cut back on anything that I think will have a negative impact on my health. Because one day the medication might stop working as well, who knows, or I might have to come off it. So I don't want to be doing anything that's still causing me harm.
Lovely. Well, thank you. And I must just say, Kat and Varsha, there are great compliments all over the chat, thanking you both for the fabulous presentations and sharing these problems. Now, one of the things I was going to ask you both is that you've both mentioned feeling washed out when you've been having heavy bleeding, let alone the pain. And then often women will tell me, well, yes, but I don't want to take iron tablets because they really upset my tummy, or they make me very constipated, or they give me the opposite. So where else would you go? Kat, let's start with you and then go on to Varsha. Where would you go to try and increase your iron, particularly if you're a vegetarian and you're not eating red meat?
Greens, and the darker and leafier the greens, the better. So you want to look at spinach and you want to look at kale. But also one thing I learned through this process as well, it is worth speaking to the doctor, because sometimes it's not about the iron that you take in, is can your body use the iron? So you could be eating a lot of kale, you could be eating a lot of spinach, but if your body doesn't have the ability to convert those foods into iron, it can be problematic. So if you're one of those people, it might be worth going back to the doctor and seeing if you can get something, because I know you can get iron injections as well. So there might be a way around it, because I regularly donate blood and I had to stop. They banned me for about a year because I turned up 3 times in a row. I don't know what I thought I was doing, still trying to live a normal life, going to A&E every month, being sick and bleeding like a stuck pig. But I tried. And they were just like, you know what, we're going to have to ban you, come back And yes, it took about a year for my iron to get back up. So just be careful if you're eating those things and they're not working, you might need to find another way to get the iron in you. Would you agree with that, Dr. Varsha? Have I said that correct?
Yeah, absolutely. So diet is always a good place to start. Like Prof said, there are supplements that we can give. So these can come in natural forms like iron infused water that you can buy in the supermarket or health food shops, to sort of iron rich food liquids that you get as well. I don't want to give out any brand names because I'm sure there are lots out there. And then we have lots of different types of iron tablets. So the doctor might try one iron tablet, but there are lots of different versions of iron that can be taken as a tablet, and some might suit someone's stomach more than others. There are liquid forms that we can prescribe as well of iron. And then finally, as Kat, you mentioned, an iron infusion, which none of these products are without risk, but I think it's important if you are bleeding so heavily that it's making you feel so exhausted, getting that iron count up so you can build up your blood count is vitally important.
That's lovely, thank you. And I would also add that many patients I tell are surprised when I say, and if you're going to take these iron tablets, take them with some orange juice or something that's a bit acidic, not with a very milky drink, because lots of milky products actually reduce the absorption from your gut. So that's a very important thing. You need to hang on, take it with something that's a bit acidic, and it'll absorb much better. So that's really, really helpful. So shall we move on to some more? There's lots and lots and lots of questions here. One of the questions has been, or several people have asked, is do these problems get better with age or worse with age? Kat, what do you think?
Oh no, it's difficult to tell, I think, as someone obviously who hasn't had children, and then also as I've been on and off these contraceptive medication all my life. So I think with me, it's really hard to tell because I have quite a disruptive history with my periods, but it definitely, the way it blew up in my 30s, I'd never experienced that in my 20s. And Dr. Varsha, you might be able to answer this as well. Like, that's why I always wondered, was this something that started when I was young or that was hiding and all of a sudden went mad in my 30s or 40s? Or do we think it's normal as we get older to have problem periods?
So I think, yeah, quite often we see it, fibroids and adenomyosis really peaking, the diagnosis is really peaking in the 40s. And it tends to be that's when women have maybe had their families, if they're lucky to be able to have children, and they've completed their families, and now they're focusing on, okay, what's really happening with my health? And then period problems come up. Oh, I've been having this. Quite often women will say for 15, 20 years, I've been suffering with heavy periods, but I think I should do something about it now, and then come to clinic. Unfortunately, I think these problems get worse with age. Fibroids, the way they are composed of the tissue of the muscle layer, adenomyosis, it's tissue from the lining of the womb, it doesn't just disappear, it's still there. And so even if the symptoms are treated by, for example, a uterine artery embolization where you stop the blood supply to the womb temporarily, it leaves behind some scar tissue. And I think ultimately we can't take away the fact that that scar tissue is still there in the muscle layer of the womb, and that could still have an impact. And also, even if we were to cut it all away, so take out all the fibroids that are there, there's still the potential that you could grow new fibroids. And so I don't think that we can ever think about this lightly, that, oh, with age, it's going to settle down and go away. I'm always quite realistic with patients to say that, look, I'm really glad that you've come now, and we really need to look at what we can do about it. But the fact that we are taking what you're saying to us seriously.
Lovely, thank you very much. Now, this is a very important question. One of our audience is asking, do you have any advice on how to approach doctors who don't seem very receptive, particularly if you're not looking to start a family but suffering? Often it seems to me that doctors are only willing to look further if it's affecting pregnancy attempts. Now, you might both want to say something about that. Kat, what's your reaction to that one? One
of my tips is to keep talking, because the thing is, these things, they do blight our lives. It's not just about a fertility child thing. It is that if your life has been blighted by this condition, and obviously we know there's a lot of pressure on the NHS due to, you know, the pandemic, but you just got to keep on trying. And I think if one doctor doesn't talk, you need to find another. And if you are privileged enough to have money, I know people who have also gone private as well, just to get a diagnosis. And I think, you know, I look back and I wish now that I had just not settled to go on the pill or not settled to go on the injection, which just smothered the problem. But I wish now, looking back, that I had kept going and kept going and kept going and kept going until an answer was found, because we've all got a right to be fit and be healthy. So I think it's not easy when you're in the face of professionals, and you two are both doctors, so maybe you can help as well. But one thing I was told was, try to explain your pain in a way that people understand. Might be easy for me as a poet, as a writer, but it's like, you know, it's a stabbing pain. It feels like someone's squeezing my ovaries. It feels like there's a hot poker. That's the kind of language I started to use in the end, because that's the kind of language that people really started to understand. When I was like, oh, it's just painful. No, I feel like I want to smash my head against the wall. That is the kind of very evocative and emotive language that I was using. And to be honest, that seemed to have more of an impact rather than just saying it hurts or I'm in pain. But my big tip is just don't stop till you get answers. Don't stop. Do not take no for an answer.
Varsha?
Yeah, I have to agree completely. I think keep talking about it. I think everyone here, even if you talk about it when there aren't any problems, I think that helps people who do have problems to speak up. It is still unfortunately a taboo topic, and unfortunately, I mean, as much as I would love this to change, as doctors, we don't get much time in our training to talk about or to learn about heavy periods. And then when we go on to different specialties, and I'm not making an excuse here, but quite often women's health just gets pushed aside. And so I think it's important, if it's a problem that's affecting you, keep bringing it up. I think, so I was talking to someone recently, I feel with pain, people will listen because everyone can experience pain. With periods, not everyone experiences periods. And I'm not saying that only half of the population will not understand about heavy periods, because that's just not true. But quite often it's very difficult to relate to heavy periods as it is to having a lot of pain. So I think it's more important that we talk about all of these things and try and get answers. And really, if it's not working, really just put yourself out there, ask for a scan, ask for a referral to a gynecologist so it can be investigated, advocate for yourself.
Thank you. And regarding a scan, several people have asked about the best way to diagnose adenomyosis. I mean, I think fibroids a little bit easier because of the imaging that we've got, but what about the adenomyosis?
Traditionally, diagnosis was after a hysterectomy. As I mentioned, now scans can be done. So the evidence is that there's not really much difference between an ultrasound and an MRI in diagnosing adenomyosis, if the person who's doing the ultrasound is looking for it. So when you're asking, if you think that you have adenomyosis, when you're asking the doctor to request a scan for you, ask them, can you put on there, is there any evidence of adenomyosis? Or when you're in that scan room, ask the sonographer, is there anything that looks like adenomyosis on my womb? Because unless someone's looking for it, they won't pick it up.
Very good advice. Thank you very much. So we've got to be advocates for ourselves. We've got to empower all the women in this audience to say that they want to have more investigations if they've got these problems.
Can I just, make a quick point that I do think it's important to recognize that when you're feeling like crap, it's not always possible to do that. So what I found was having someone else to advocate for me. So whether that's a partner, whether that's a friend, get someone to come to the doctor, get someone to come to the consultants with you, get someone to come to the A&E with you, because when you're physically feeling awful, you cannot always, I'm a very articulate person, but you don't have the patience, you're irritated because you're vomiting or you're just not feeling great. It's great to have someone else you can almost hand over, to write down your questions beforehand. That was one thing that helped, writing down my questions and the things I wanted to ask for beforehand, and having someone with me who could ask the questions or advocate for me when I didn't have the strength or the health to.
You've read my mind, because I was going to say...
I'm sorry, did I butt in there?
Not at all. I'm just much better coming from you. But I think it's so important to take somebody along. A second pair of ears often hears things that the woman who's really suffering may miss. And, you know, it doesn't matter how clearly it's been spoken about, you know, you do have selective hearing in these very stressful situations. So that's important. There's another question here about ferritin levels, and I thought I would mention something here because often people say, what's your blood count, what's your hemoglobin? And if that's okay, you're sometimes dismissed. But in my experience, it's when your ferritin level goes down, which is a measure of your body iron stores, that's when women feel really washed out. And Kat, you know, if you had a sudden very heavy bleed this week, your hemoglobin wouldn't go down. But if you've been having heavy bleeds for a couple of years, or rather, sorry, your hemoglobin might go down, but your ferritin, your stores wouldn't. But if you've had persistently heavy bleeding, eventually the stores will get depleted. So even if your hemoglobin, your overall full blood count appears to be normal, if you're feeling exhausted and you know you're having heavy, painful periods, do go and ask for a ferritin level, because that's sometimes really, really helpful. And one of our listeners is saying, yes, she got down to a ferritin level of 2 when she needed to be over 40 to get better. You know, we need to make sure that people are really well educated about that too. And also very interested in a question here, is there a way that passionate women about women's health could contribute to some research or projects or volunteering, etc.? Well, I'd be missing a trick if I didn't say, please go onto the Wellbeing of Women website. You can either make a donation to help with our research, or you can volunteer as well. There's lots and lots of information on there, and our website is getting better and better month by month. And we're hoping as well to be signposting women with all sorts of problems across their life course. But yes, you're very, very welcome to contribute. There will always be something for interested women to do and to contribute to the charity and to improving women's health across the life cycle. Now, Varsha, are there any other points that, oh, thank you. Someone is, I think Lena's put the link in the chat now, www.wellbeingofwomen.org.uk. And you can navigate from there to the bits you want. Information, where to go for clinics, you know, et cetera, et cetera. Varsha, are there any other questions that you think that we've missed out and that you'd like to address, or something that hasn't come up yet that you'd like to contribute? And then I'll move to Kat.
No, I think normal, I wanted to just highlight that I've spoken about normal in my presentation, but normal can be different for different people, and what certain people can tolerate would be different to what certain other people could tolerate. So somebody who maybe has been working from home for the last 2 years during the pandemic may have been able to handle heavy periods because they have constant access to their toilet and menstrual products. But actually, if someone needs to actually physically travel into work, or they work a long distance away, they have to work on site or field operations, heavy periods may be a very different deal for them. So I think the other thing is, as women, I think there are a lot of women in the audience. Quite often, a lot of my patients come in and say, well, a lot of the women in their lives just told me just to handle this and just get on with it. I think it's important that we don't impose our normal onto other people. I think if someone is speaking up about their periods, that it's affecting them, I think encouraging those to go and seek help is probably what I would say, not to say to be put into that table and that's all you need to say, well, you're within normal, that doesn't matter. I think subjectively it's also important as well.
Thank you very much indeed. That's really helpful. Kat, do you have any comments that you'd like to add there?
Yeah, I think you've made a good point, because I think those of us that do suffer from bad periods also may feel that we have to hide it. And I look back and I look at how much I tried to hide and how much I tried to live a normal life. And, you know, unless you lived with me, you wouldn't really know. I can remember working and going out of a classroom, you know, teaching sessions, vomiting, wiping my mouth, brushing my teeth, and coming back in again. I can remember sitting in toilets and injecting myself with anti-sickness injections. When I look back at the level of the madness I've done. So one thing I would say is it's really important to talk. There are empathetic people out there who understand. Maybe they didn't suffer, but maybe their daughter or their girlfriend or their daughter-in-law did. Really important to talk, really important to get help. I was scared about going to A&E. It's not until I spoke to my cousin who had endo. She was like, Kat, if you're that bad, go. And I have never got turned away from A&E. I'm not saying you're not going to wait for a long time, and I'm not going to say that each experience may not be different, you know, especially now with everything that's going on, but I was never, ever, ever turned away from A&E. And I do think it's really important to have honest conversations with the people around you, your partner, your family, your children. It's illness at the end of the day, and I never looked at it as a chronic illness. I do now, it is a chronic illness and it must be managed that way. Just because it's coming from in between our legs, there's so many kind of, you know, taboos around it, but it's a chronic illness and you wouldn't treat somebody who had any other type of chronic illness in the way in which women who have problematic periods are treated. So sing like a canary, be honest, and I think that's when we can start to get help. They're not just periods.
Lovely, thank you very much, Kat. One of our audience is asking about are there symptoms that would present to a woman who is continuously on the pill from a young age, and is that pill likely to be masking any potential symptoms? So important question, because we wouldn't want people to stop using a contraceptive option that they find very helpful, but I think there's a worry there that possibly this is masking something. Varsha, do you want to comment there?
Yeah, so the way the pill is working, it's regulating the hormones and the signals from the brain that are stimulating the ovaries and then the lining of the womb. And what symptoms I think the question is asking is that I think if you have a certain pattern of bleeding when you're on the pill, so if you're doing sort of 3 weeks of taking the tablet and 1 week where you have a withdrawal bleed, if that bleeding is changing in any way, if your bleeding pattern is changing in any way, I think that's really important that you seek help at that time, because that's sort of a red flag symptom that something has changed. And also, I think if you start getting breakthrough bleeding in between your cycles where you're not supposed to be bleeding, that's when you need to be seeking help. Some women who have the Mirena coil will have very light periods or no periods at all. And then all of a sudden, after 2 or 3 years, oh, the Mirena coil's not working anymore. That's the time when you question, why is it not working? I need to get this investigated. So it's any sort of, if you're on hormonal treatment, if there is a change to your cycles, if something's happening, that's when you question it. Why is this not working? And Prof, you mentioned before my experience with space medicine. Astronauts use these contraceptive agents for a long period of time, and it's absolutely fine. The pill, the Mirena coil, doesn't have an effect on fertility, so you can be using them back to back, and the studies show that you can be using them. So if those are controlling symptoms of heavy periods, you can keep taking them. It's not a problem. You don't need to give your body a break. It's a very low dose of hormone, and it's absolutely fine and safe as long as the rest of your health is all right. And that's, you'll be working through that with your doctor.
Thank you, that's really helpful. So please, audience, don't be fobbed off by that old wives' tale as you shouldn't be on the pill and you've got to come off for a break. If it's helping you and you're helping your symptoms, then it's fine to continue. Thank you so much for all that really helpful advice. So someone's asked us to put the website up again into the chat, and I think Lena's done that for us. Thank you. And I think I'm drawing towards the end of our questions. Is there any last comments that either of you would like to make in the last couple of minutes? I think you've both been absolutely fantastic, may I say. Really wonderfully informative and very clear, both of you. And I think the audience are probably going to join with me in a few moments to giving you a virtual round of applause. But Kat, any comments you'd like to finish off with? Any message to our audience from your experience?
Well, I think today was an amazing opportunity to talk. So I think that's what I want to leave everybody with, as someone who does teach sex education and puberty. If you've got daughters, talk to them. If you've got sons, talk to them. You know, women who are having problematic periods may have partners who need to support them. So I think it's something we have to talk to our young people about, talking to bosses, talking to friends, talking to family, talking to your partners, talking to your children, so that we normalize these chronic conditions that so many women are suffering from. Thank you.
And Varsha?
Yeah, so I think for me, it's been really powerful to be a part of this session with you, Kat, because I think it's very easy for me to put across an informative presentation, but I think your story has really added to the power of how this is really affecting women. I think for me, what people often say is, oh, it's just a benign condition. Fibroids and adenomyosis, it's benign, it's not cancer. But I think you can see that this is affecting every single aspect of a person's life. Periods and heavy periods really do have that huge impact. And so I really would say that if anyone is suffering from heavy periods, please don't just be told that, oh, it's benign, it's okay, we don't need to worry about it. I think just going back to before, you really need to sort of highlight how this is affecting you. But yeah, thank you very much.
Marvellous. Well, we've come to the end of our time. It's now 5 to 2, and I'm going to let you go in just a moment, but I want to say thank you again to our 2 wonderful panelists. You've been absolutely superb. The audience you won't be able to hear, but I'm sure they're whooping and congratulating you in the background. I just want to remind everybody that if you are interested in pursuing this women's health, go to the website, or you can email us at hello@wellbeingofwomen.org.uk. That's also in the chat, and you can start off a conversation with one of our team in the office. And I also want to just remind you that Wellbeing of Women, or WOW, funds research into gynecological problems that affect women at all stages of their lives. So this is really incredibly important research. It's some of the work that Varsha's now doing that in the past has been overlooked, and it's been underfunded for far too long. So we thank you for coming today and for your support. And if you'd like to sign up and make a gift to us, please do so on the website. But most importantly, will you remember how, as I started off, that this is a first in a series of Let's Talk About Periods. So look out on the website for the adverts for the next episode and come and join us then, because if we all keep talking, as Kat has so eloquently urged us, then we'll actually make this top of the agenda for women's health. And that's where it deserves to be. So thank you very much, everybody. You've been absolutely wonderful as an audience. Thank you for your questions. And again, I can't thank Kat, Francois and Varsha Jain enough for giving up their time and sharing their expertise. Thank you and goodbye.